I'm Dr. Jacopello. Thank you for joining us for the ACOs and different kind of psychiatry case presentation webinar. I'm happy to introduce our speaker today, Dr. Chris Burritt, who will be presenting The Salesman Who Needed to Cry.
Thanks for having me today.
Welcome. Dr. Burritt treats children, adults, couples, and families in his private psychiatric practice in Westchester, Pennsylvania. Dr. Burritt is board certified in both child and adolescent psychiatry and general psychiatry. He is a clinical associate of the American College of Orgonomy, and he develops and hosts the ACO's podcast program and different kind of psychiatry. Before we start, I just wanted the audience to know that if you have any questions or comments, you can type them into the Q&A section as soon as you like, and we'll get to them at the end. Dr. Burritt, how did this patient come to you?
So my patient, Steve, called me because he was having panic attacks. He mentioned on that phone call that he'd actually had panic attacks before, but the last one was maybe 10 years ago, and it was never like this. He was having panic attack after panic attack, and the panic attacks were so unsettling for him that they would actually trigger another panic attack, and it became this vicious cycle that he could do nothing to get out of. But what really stood out about that phone call was as he was telling me this, he had this urgency in his voice, but he had almost no sense, it seemed, that there was an emotional problem going on. It was like he was urgent to call a plumber for a leak, but had no sense that there was an emotional problem going on within inside of him. Even though he told me, Dr. Burritt, I broke down and I cried with my wife, and that's not something I've ever done before.
Had there been any trigger he could identify, he could tell you?
He had no idea what was going on or where it came from.
So what was he like?
So we agreed to schedule a consultation appointment so I could get to meet him and he me, and so I could hear more about what was going on to see if I could help. So Steve was 40 years old. He was dressed well in jeans and a button-down shirt and nice loafers, and he came into the office, and what was so striking was he literally put his arm back on the couch, crossed his leg in front of him, and told me about having panic attacks, about the shortness of breath he would feel, about the chest tightness or feeling his heart racing, about different worries that would come up when he had one, about being seen as incompetent. But it felt like we were in a casual business meeting. It was, I couldn't ignore it. It really stood out. It stood out so much that I said, Steve, are you worried at all? Are you worried you won't be able to overcome these panic attacks? Are you worried you'll need medicine or I won't be able to help you? And he said, Doc, I've been at a low point. It's only up from here. I'm confident things are going to get better. And I said, Steve, it sounds like you're selling me. Maybe you're selling yourself. And he paused for a moment and said, well, I'd be willing to consider that. And so I wanted to hear more about his background. What was his childhood like? What was his family and social life like? And he told me, well, my mom is good. My dad is great. My younger sister's good. And I said, you sold me. Everybody's good. And he laughed, but he said, Dr. Burritt, life is great. All I need help with is panic attacks. Can you help me overcome my panic attacks? And I said, Steve, I've helped patients overcome panic attacks before, but panic is an emotional problem. You're feeling intense feelings that are bursting through, and you have no connection with what's going on other than this feeling of fear and anxiety. Your ability to overcome your panic attacks is dependent on your ability to face your emotional life. Are you up for that? I wanted to challenge a little bit because I could tell he could take a challenge. And he thought for a moment and with very little hesitation said, Dr. Burritt, I can do that. When do we begin? He was ready to charge forward.
Were you expecting that he was going to ask you for medications, or did he ask for any medications?
No, not at all. No.
Okay. So how did you treat him at the beginning? What did you think you needed to do with Steve?
Well, what I gathered from that first phone call and the consultation appointment was what I mentioned, that salesman attitude, that confidence he had was the most superficial aspect of him. He met with me with confidence, and I could tell he was afraid and anxious, but I also had a sense that underneath his anxiety also was courage and a drive that could help him overcome his anxiety and panic. And so I thought it was important that he was up to the challenge and that he had a sense of his ability to overcome things. So I didn't bring up medicine at all. He didn't bring up medicine at all, other than to say, like, I don't want medicine. I feel like I can handle this. And I thought that was worth bolstering, that confidence he had to overcome his emotional life, even though he was a bit wary.
Yeah. How was he? Did he say how he was doing in his life in general? Let's say his work, his family life. Did he give you any more specific?
Life was great, Dr. Jacobello. That's what he told me.
That's all. He didn't. Okay.
Everything in my life is good from head to toe. It's just panic attacks. That was how he presented himself. I was skeptical, I'll tell you that.
Okay. So this was all the first session, or you are already?
That was the first consultation appointment.
So what was the plan then at the end of it?
So we agreed to begin therapy. So when he came in for his I'll tell you about his first session. The first 4 sessions really stand out, and maybe we can highlight each one as we go along. So when he showed up for his first session, it was like he was ready to go. Like, coach put me in, tell me what to do. I'll do what I have to do. And so he told me more about his panic attacks. He told me all about the different variations he experienced. Sometimes he felt more in touch with feeling short of breath. Other times he felt more in touch with his heart racing or the worries that came to his mind. And again, though, he looked so calm. And I said, Steve, how do you feel right now just talking about what's going on? He said, I feel fine. And so I wanted to ask him more about what he said on the phone about crying with his wife. And he said, I've never done that before, but I broke down crying with my wife. And I said, what was it like for you? And he said it helped him feel a little bit better. It's something he never imagined himself doing, but it did seem to help. And then I said, Steve, do you allow yourself to cry? Does that ever come up in other circumstances? And he paused for a little bit, and he told me actually just a few days ago, between the consultation appointment and his first therapy session, he said he did feel a need to cry for a moment, but he stopped it. He wasn't sure how, but somehow he disconnected with that feeling. And what he told me was that he was reading a story about someone overcoming panic attacks, and he connected with this, a sense of tears of joy. Like reading this story about someone else overcoming panic made him feel happy and joyful that, yes, he could do it too. And I looked at Steve seriously, and I said, Steve, I have a sense you may need to cry. And he paused for a moment and said, I'd be willing to consider that. But again, it wasn't clear that he really allowed himself to hear what I was saying, but just to a small degree. I'll be willing to consider that.
It looks like there was a feeling of detachment, or I would say an emotional block, where he would just have the panic attacks, but otherwise he will not be in touch with his emotions.
Yes, I would say that's accurate. So in that first session, what I asked him to do was, even though he felt fine and there was no sense of panic or anxiety in him with me in the office, I wanted him just to lie down and take some deep breaths and just see if any other feelings came to the surface. And he lied down and he took some deep breaths. And at first he did these big, deep breaths, like he was going to really charge forward and do the best deep breaths he could do. And then he allowed himself to relax a little bit and just took some deep breaths, and he started to look very sad. And he stopped himself and he said, "Dr. Burritt, I feel too vulnerable right now. I just allowed myself to cry with my wife. This is too much." And I just said, "Okay," and I didn't push it. But then he sat up and he had this big smile on his face and look of excitement. And he said, "Dr. Burritt, what was that? What just happened?" And it was an opportunity just to help him see that just allowing himself to breathe could allow himself to connect with his feelings, and that often we hold our breath to disconnect from our feeling. And his excitement with that realization of his breathing being connected with his connection or disconnection with his feeling was a very good sign to me. And so before we stopped that first session, he wanted to know what to do. Should I do more breathing exercises? Should I read something? And I said, "Steve, why don't you just ask yourself each day, how am I feeling? Just take an inventory of what's going on emotionally with you each day and see what comes up." And he agreed to do so. And it felt like it was off to a really good start.
I think what you describe is something typical that happens with many patients, because once they are on the couch and you ask them to breathe, then they think those are exercises that they can do at home. They ask if they should do them or not, because it's more difficult for them to understand the emotional part and the interaction with the therapist. I think that's a very familiar scene, what you described for me. I was wondering, did you come to know if he was allowed to cry as a child? Or did you come to know that later in therapy? Or was crying a forbidden emotion?
So I think we will get to that. Let me tell you about his second session. And that is an important aspect of his life, and that came out in his therapy. That's a good question. When he came for his second appointment, he didn't look confident. He didn't look like the salesman. He looked anxious and desperate, actually. And he looked terrified. He said, "Dr. Burritt, I've been feeling anxious every day. I've been having more panic attacks than ever. And every day I come home and I've been crying with my wife. What do I do? Should I be taking Xanax? You told me not to do breathing exercises. You told me just to ask how I'm feeling, but I'm overwhelmed. There's all these feelings every day." And he's telling me this, and I can tell he's overwhelmed feeling, but inside I'm feeling wonderful. I'm feeling this is great. He's really connecting with his feelings, and he's able to show it to me on his second appointment. He's able to let go of that confident salesman and just be anxious with me in the office. And I saw that as a wonderful sign. But before I said anything about that, I wanted to hear what was going on with his work life and his daily life. Was his panic and his emotional turmoil, was that interfering with his work? And I asked him a lot of questions, and it came out that he was still doing a very good job with work. He'd become very successful, and this wasn't stopping him, even though he was having so many panic attacks, even though he was crying, something he recently had never let himself do. He was still functioning well. And so I said to Steve, I said, "Have you considered this is a good thing?" And he kind of looked at me like I was crazy, like, "Well, this isn't a good thing. What are you talking about?" I said, "You are more than just a confident, successful salesman. You have a lot of deep feelings, and they're coming out. You're connecting with them, and that is a good thing." And he kind of paused for a moment and told me that between sessions on the weekend, his family had come to visit. His parents were arguing with each other. He got in a fight with his younger sister. And he let on that actually his family in his childhood were not all great. He had difficulties growing up. He felt overwhelmed often when he was a kid, especially when his parents were arguing. And it basically came out that he became the strong one. He became tough. And instead of feeling overwhelmed, like, "Oh my God, everybody's yelling, I can't take it," he became a little bit stoic and confident and tough. And he became the strong one for his younger sister to help her. but he became terribly intolerant of being vulnerable and not being the strong one. So he actually had a lot of intense feelings as a kid, and he started to turn off his ability to cry, essentially.
I see that's something that often happens in a patient who have panic attacks, and this also makes me wonder. The other emotion is anger. Were you able to see any anger underneath? Did any anger surface during the course of your treatment?
A little bit of frustration has come to the surface. But I think the well has been so deep with his crying that even now, a year later, we'll describe kind of the course of events. His crying is so prominent still that there may be some anger underneath, but the crying is what's closest to the surface and where he's most connected.
So how did he start to do better? Or how many sessions you were able to see some improvement that he recognized?
So after that session, when he was telling me how panicked he was and how anxious and overwhelmed because there was just intense feelings every day, I encouraged him to keep up with it, keep connecting with his wife. It was coming out that how much his wife helped him, and how him allowing himself to cry with her, feeling overwhelmed after a hard day's work, even when he was having panic attacks, and getting through it and still being successful, that offered him a lot of relief. So I encouraged him to still keep it up. And then when I saw him for his third appointment, he actually described feeling okay, but feeling disconnected and not quite sure how he was emotionally for most of the week. And what we found out was that his in-laws now were visiting, and they were staying with them at the house. And only when they left did he allow himself to connect more fully with his wife and allow himself to cry and discharge some of his feelings, including his anxiety and sadness. And it was a good opportunity to educate him that before, and for a long time before he came in for his therapy, he was disconnected from his feelings and had no clue that he was disconnected. And over this past week, he didn't ask himself, like I instructed, to ask how he was feeling, to take an inventory of where he was emotionally, but he did it on purpose because he didn't want to connect with his feelings when his in-laws were there. He didn't feel comfortable to do that. And so he made a conscious decision, I'm going to keep them at bay for right now until I can be with my wife and allow myself to feel vulnerable. And I think that was perfectly rational to do, but it was a conscious decision. It wasn't some unconscious disconnection from his feeling.
I'm wondering, did he have any negative feelings towards his in-laws?
No, it was, he just didn't feel comfortable with them exposing this part of himself, this emotional side. He wasn't as close with them as he is with his wife. And in fact, his wife was the only person, and then with me as his therapist, he's expressed any of this to at this point.
So is there any other things that you did, any other interventions that you felt were helpful for him? What you had talked about is very important. It is something that gets lost often because patients want us to do something for them. However, just being able to feel and stay with the emotions can be very helpful. But I wonder if there were any other interventions you used. Did you do any biophysical work? Anything else you can tell us?
So for your first point, I think that's a good point because he's very much a doer. He takes action, and I had the sense that he needed to do less. He wanted to do something. He wanted to do breathing exercises to get over it and get through his feelings rather than allow them spontaneously to come up and allow himself just to feel it and express it if necessary. And so there was a very much doer aspect that he wanted to push the process of therapy rather than allowing it to unfold. And so that was part of his education, was to kind of hold his horses and allow things to progress rather than push them forward. But that third appointment, when he was telling me about, closing himself off on purpose, he also told me how he was connecting with one of the other executives at work. And his coworker was telling him, our company has been doing very well, and we've made it farther than I think any of us imagined. And a lot of that is due to you. And, you've been successful personally, but our business has been very successful. And he was telling Steve this, and Steve realized that he always had his head down. He was always driving forward. He didn't allow himself just to pull his head up and look at what he'd accomplished and feel the pleasure and satisfaction of it. So I was helping Steve not only to look at the sadness and anxiety and fear he had, but to help him realize that there was also this pleasure and satisfaction that he wasn't allowing himself to connect with. The collateral damage of blocking himself off of his painful feelings was that he wasn't feeling the satisfaction and pleasure of how successful he was at work. And I think that really resonated with him and was helpful for him to get of why do this hard work? What is the point of allowing yourself to feel the pain and misery of some of the feelings that have been locked away to feel better and to feel satisfaction with life? And so when I had him lie down for that session, I instructed him again just to breathe. And quickly again, he started to look sad and he started to feel sad. And then he said, Dr. Burritt, I started to feel sad and I'm going to do my best to allow myself to cry, but it kind of went away. And so I said, let me feel the muscles in your head and neck. And I palpated his neck and his head, but his jaw was very tense. But rather than push on it, I just instructed him to allow some sound out as he exhaled, to take a deep breath, and let some sound out. And as he did so, I really had the sense that he connected with something intense, because he was lying down and he shot straight up and said, it felt like a shot of adrenaline just went through me. I don't know what that was. And I had the sense that he was overwhelmed. It was an intense feeling that he couldn't quite tolerate at that moment. But rather than take a break, I just instructed him, just keep breathing, sitting up, facing me, not lying down on the couch, and just allow some sound to come out. And he did that, and he looked more sad, and then he allowed himself to cry. And the crying, after a few minutes, turned into sobbing. And so here was this confident salesman who hadn't allowed himself to cry, now sobbing on his third session. And it was really remarkable, because he's a tough guy, and it took a lot of courage for him to allow himself to cry and then sob like this. And I was impressed with, on one hand, how much he could get in this confident salesman character one moment and then allow it to relax and allow his feelings to come up another. I was very impressed, and I saw that as a very good sign for what was to come and his ability to overcome his panic. When he came for his following session, it was 2 weeks later, and he told me how he was feeling a lot better. He actually had 0 panic attacks. And he made a conscious effort just to allow any feeling that came, just to feel it, not push it away, not hold his breath if he was aware of it, and just allow it to come, and have some confidence in my encouragement that he could do that. And he felt a lot better. And it was an opportunity to help him see that if he allowed himself to have those feelings come up, he was not going to have panic attacks. The panic attacks were intense feelings breaking through his holding them back. And he reflected.
One question. Listening to you, I'm wondering, although you are talking about his work situation, I think it would be more helpful to the audience to know also what was exactly the work he was doing. I think we give us a better understanding of what difficulties he may have been encountering in his everyday life. Can you say anything about that? We know he was a salesman working for a corporation, but maybe a little more detail will help us.
Sure. The one thing I just want to say was, when he had those good 2 weeks when he didn't have panic attacks and he realized that he really had to face his feelings, he reflected on that and wondered, like, was he up for the task? Could he keep doing this? He did it successfully for 2 weeks, but could he persist and continue to do that? And after reflecting on it, he decided, yes, I can do that. I have the courage to keep doing this. But then he wondered, Dr. Burritt, am I just selling myself again? And I had absolutely no sense of the salesman or overconfidence. It really sounded like he was taking stock of what he was up against and what he was capable of, and had a sense of his courage and confidence that was part of his nature, not part of this facade or part of his character that was covering over his anxiety. And so he really connected with his deeper abilities of confidence and able to drive forward and face his feelings. Now, to your question about his work, that's the most remarkable thing about this. He didn't run into problems with work. He can continue to work even though all these feelings felt so destabilizing and overwhelming for him. And what he did, I found out, was often he could face the anxiety, but if he was unsure if he would be able to handle it, or if he felt he was going to be off in a business meeting, he would engineer the situation. That's the kind of guy he is. He would take control of a situation where, ending a phone call, rearranging, rescheduling an appointment. He's an executive, so he could take charge. And in a lot of ways, that worked out well for him. He could arrange his day, arrange his week, travel for a way that he wouldn't feel too overwhelmed. And what we discovered in his therapy was that could be rational at times, and then there's other times where he wasn't confident in his ability to deal with his feelings, and so sometimes he was shying away from it. And so as we continued to work together, we would look at it, is this something that he could face, or is this something he needed to engineer the situation to prevent him from having a panic attack because it was just too much? Often it wasn't too much, but he wasn't always confident, and he wasn't going to let anybody know about it. Dr. Iacobelli, you asked about frustration. The frustration came out the most, actually, in his therapy with me. And the way it came out was when he started to have panic attacks again. He had this period of intense panic attacks and anxiety, a period of calm, and then a resurgence of panic attacks when he connected with some deeper feelings. He started to get upset with me, like, you're supposed to be doing more. Why aren't you helping me with this? Why are you telling me to read a book that can help me? And he kind of painted me in this bad light, like there was something I was supposed to be doing. And it was, it had a dependent quality, like I was letting him down, like, why aren't you doing this for me? Why are you taking care of me? But it was a perfect opportunity for him to express his frustration without causing his wife any trouble, without, berating a subordinate at work. He could discharge his frustration with me, and also show me another part of him, which is that he had a dependent quality in him too. As much as he could take charge and control the room, he could also be dependent and want to be taken care of.
So how was for you to see that, and how did you handle those negative feelings toward you?
I did very little. With him, less is more. And I don't remember exactly what I said, but I think it was something like, I appreciate you letting me know. Just, we're talking about your feelings and you're letting me know your feelings toward me and your therapy. And I think that's great. And it didn't become anything more. I didn't get sidetracked by it or kind of fall victim to it and start to think like I was supposed to do more. Because that was part of his emotional discharge. It didn't actually have much to do with his therapy.
In therapy, there are times when we encourage the expression of negative feelings. So I wonder if what made you feel like you didn't need to do that, rather than prodding for more negative feelings.
So I didn't ask for that. He brought that to me, but that's always an opportunity to ask for more. You told me this is something you're frustrated with. Is there anything more? And he said no, and I believed him, and nothing more came of that. But to me, that was a good opportunity for him to learn that wasn't off the table. He could tell me how unsatisfied he was. He could tell me if he was frustrated with me. And that allowed him to know he could do that if it came up again.
I was thinking, how about maybe we would like to hear a little more about the relationship with his wife. Did anything come up during the course of the therapy about his relationship with his wife?
So what came up, and I often asked about that, he wasn't bringing and telling me things about his family life and his personal life as often as I was asking. And I was doing that on purpose because he kept things narrowly focused on panic attacks and work often. Like I said in the beginning, everything is great. And so I often asked about that. How are things with your wife? How are things with your family? And what I learned was things were actually going very well with him and his wife. And he realized that he could get frustrated or resentful, and it often had nothing to do with his wife, but that's what he started to feel when he felt closed off or not connected with his feelings, as if she was supposed to do something about it. He had some sense that something was off or wrong, and he focused on her. And by focusing on him in his therapy, he started to see his role in the relationship. And it often was, if there was a frustration, it was often within him, but he was putting it on to her. And the more he was able to recognize that, the more appreciation he had for her, both in terms of not being covered up with resentment or frustration, but also he could see how much she was helping him. She wanted to hear how he was feeling. He was 40 years old, and now he's finally opening up with his wife. I wouldn't be surprised if, for 10 years, she's been waiting to hear more about his emotional life, including his anxiety about work, including his sadness. And the more she heard it, the more connected she felt with him. And I think the more connected he felt with her. So it was just this almost compounding effect that they both started to open up more and both feel closer. The more he revealed himself, the more she could reveal things that she didn't before. And it was just lovely to see the, secondary effect of this guy just trying to overcome panic attacks, develop a deeper relationship with his wife and appreciation for how much she was doing for him. It was very lovely to see.
Did he recognize that? Did he recognize that progress?
Yes. And often he would come in for therapy sessions, and when he was connected with crying, it would be an appreciation and love for his wife, which was wonderful to see. And just to feel, oh my God, this woman I love, she could hear what I have to say. I can feel vulnerable with her, and she just wants more. And that was actually pretty frequently something that would come up, of just his appreciation and love for her. And I knew he always loved her, but it was I think, contained and narrowed in the way he could feel it and express it. And he's been broadening his emotional life and also deepening his emotional life in many ways. I do want to say something, because we talked about medicine earlier. For a brief period of time, he actually did use medicine. And what came up was he would have these periods of being panic-free, and then he would have panic attacks again. And when he had a number of panic attacks in a row, similar to what he had before he called, he started to get really down on himself. And when he got down on himself, he started to be really pessimistic and self-critical. And what I discovered was the medicine likely was going to help him get out of that and continue to face his feelings rather than close himself off to his feelings. So I prescribed him Xanax for, I think I gave him 10 pills, and he used a handful of them over a period of maybe several weeks. And what the function of the medicine did was allow him to get through an intense period where he felt overwhelmed without getting self-critical and down on himself, and to keep going and allow himself to be emotionally available when that period had passed. And then now, as of right now, we're doing the webinar, it's been a year, he hasn't used that medicine ever again. So there was this brief moment where he revealed this self-criticism and getting down on himself that interfered with him staying connected with his feelings, and the medicine allowed him to overcome that just temporarily. And so he hasn't used Xanax in 6 months, and he hasn't had panic attacks in about 5 months, and he's doing very well.
So it looks like up to now you have been covering the first part of his treatment. Maybe you can tell us a little bit how, once he was into the therapy, let's say the middle phase, if there was anything there noticeable that you would like to share with us.
Well, more feelings, we're talking about his wife, but more feelings came up with his parents, with his younger sister. He allowed himself to feel frustrated with how things were in the past, how they still could be now, resentment he had about how things were handled. But coupled with that frustration and resentment was also a deeper appreciation for his parents, a deeper love for them and for his sister. And they went hand in hand. Every patient's therapy is different. Sometimes there's, months or years of frustration and anxiety, and then feeling a deeper connection and love. And for him, it was simultaneous, it felt like, where he could be frustrated and feel resentment and then feel more connected with his family. He would have, his family over again, or he'd go see them for another holiday. And he developed a deeper appreciation for them that I thought was pretty rapid and remarkable, where, you read in the news these days about adult children becoming disconnected from families, not seeing them for the holidays. And even though he had a lot of conflict and mixed feelings about them, he was able to stay connected and even feel more deeply in love with his family despite those mixed feelings. So it was such a nice contrast with what we hear about in the news these days about families not being able to stay connected. He's 40, his parents are in their 60s, and it was very nice to see.
I was thinking, if you had to mention an aspect of Steve that you think has contributed to him getting better so fast and responding to the therapy so well, what aspect would you identify?
That's a good question. And, it almost feels like a combination of being flexible and open-minded. And partly maybe he was desperate enough to be open-minded enough to give himself a chance to face his feelings rather than go to Xanax or some other type of modality that wouldn't maybe get to the depth of what was going on. But like I said earlier, as much as he could become confident and, almost cocky and in charge and aloof and disconnected from his feelings, he could rapidly shift to connecting with his feelings and expressing deep feelings. So even though he became the strong one as he progressed through his childhood and adolescence, he somehow maintained a flexibility that allowed himself to remain connected, even in a kind of disjointed way. And, it's interesting, maybe a few sessions ago, I don't know, in September, I was thinking and told him, panic attacks may have been a very good thing. And I don't mean that he had panic attacks and how bad they were, but they were his connection with his emotional life. If he didn't have panic attacks, if he was more rigid, he might have not been able to then seek help, to then explore this other part of himself, these other emotions with his family or with his wife, with his work life. So on one hand, the panic was also a sign of his lack of rigidity. The panic was the feelings escaping through his character armor. But on the other hand, it kept him connected with his nature and his deep feelings. So there was just something about him that he could retain that. And I think that's helped him tremendously in his therapy.
Do you remember what was your reaction when you said that the panic attacks may not necessarily be such a bad thing? Because I can imagine telling, from my experience, telling something like that to a patient is something that can be really mind-blowing, because it is all contrary to what they have been told, what they have read, what they have been doing.
Yeah, well, when I told him that, when I told him that in his second session, I think he thought I was crazy and had a hard time believing it, but was open to considering maybe there was something to what this doctor was saying. But when I told him just a month ago, after a year of therapy, and since he's been panic-free for 5 to 6 months, I think he was able to understand a little bit more away from the feelings of overwhelm and see the connection with the fact that his panic attacks were a sign that things weren't completely rigid and solidified, and that was a sign of his connection with his emotional life. So he could hear it a lot more a year later than the second session.
Mm-hmm.
I wanted to say one other thing about, I guess we could call the middle part of his therapy. There was a period of time when he actually started to feel nothing. He started to feel indifferent, bored, and it wasn't directed toward anything. It wasn't bored at work or bored at home. He just didn't really have a strong connection to much of anything. And there was a part of him, again, that drive to do something about it. Should I be breathing more? Should you be pushing on my muscles more? And my sense was absolutely not. He needed to tolerate the changing equilibrium of his emotional life. He was shifting and there was flexibility to him. And so the equilibrium was shifting in how much he allowed himself to feel, what he didn't connect with, what he did connect with. And it was important for him just to get through periods of indifference, boredom, not quite being sure what he felt, rather than try to push it out of him. Because he had that quality of like, let's connect with my feelings. Let's get myself to cry. And it was good for him just to do nothing and allow himself to feel nothing or feel bored. And so that stood out. But at one point it was intolerable. He said, Dr. Burritt, I know I came here for panic attacks, but it's almost worse feeling nothing. Like, I almost kind of want to have a panic attack just so I know I'm feeling something. He said, I felt so desperate when I called you. I would have paid someone $500,000 to get my panic attacks go away. But now I just want to feel something. And again,
Dr. Burritt, maybe you can tell us now at this time, where does Steve therapy seem to go? Where is it going? How things are standing right now with him?
I think the best way to describe where Steve is in his therapy is figuring out what he wants out of therapy. So Dr. Chris has this great article called Motivation for Therapy, 2 Cases, and it contrasts someone overcoming a specific symptom, whether it's depression or anxiety, versus someone wanting to feel they're living their life as more fully and as deeply as they can. And that's the fork in the road of where Steve is right now. He's overcome his panic. He hasn't had panic attacks in 5 to 6 months. He still has some unease about, could they come back? But as long as he sticks with feeling his feelings, I feel confident he'll do well. But the question is, he's developing a deeper sense of there's more to him. We discovered that he likes to drink beer, and 2 beers is better than 1. He likes to watch football. If you bet on football, it's even more exciting. So he has this quality that can be unsatisfied. And the question is, what way is that affecting his emotional life? Does he want to explore that more? He used to smoke and then he gave it up and then he started vaping again. So is there more to him? And does he want to find out what else is there? That's where he is right now. He doesn't have a specific symptom that he's trying to overcome. But the question is, where does he want to go? What does he want to explore? And how deep does he want to get with his emotional life? And I have the sense that he can go very far, and he is going in that direction, but that comes up from time to time. Do I cut back on therapy appointments? Do I pause for a little bit because I'm doing well? And that's a question for him to answer.
Okay, Dr. Burritt, that's, I think, is very good. We really have enjoyed listening to you telling about your patient. Now, I would like to go to some questions from the audience. There is one question: is this how you always treat your patient with panic attacks? A listener wants to know that.
So I don't treat symptoms. Panic attacks can be different for different patients. So for instance, when I told Steve, aren't you worried at all? Are you worried you're going to need medicine? Are you worried that you won't get to overcome this? I would never say that to a lot of patients. And yet with Steve, I think if I said anything less, I wouldn't have been able to connect with him and help him see his confident salesman attitude that was helping him bind his feelings and disconnect from them. So panic attacks can be different for every patient, and so no 2 patients' therapy is the same.
Then there is a listener who is wondering what kind of body work you did to relieve the harm. Maybe you want to clarify this.
So with Steve, I've done very little, and I think that's what he's needed. So I mentioned, for instance, palpating the muscles in his head and neck and feeling his tense jaw. And, you can feel the muscles in his jaw be very tense. And when he's breathing, you can see his mouth close so that it's only open a little bit rather than allowing it to hang open. But often, just by having him let sound out was enough to allow his throat and his jaw to relax. And there may come a point when he needs more pressure on his jaw, but it's been very helpful for him to connect with the feeling of tension. He had no clue that he would be tense in his jaw. So to go slower and allow him to perceive the tensions in his body, to perceive the feelings that are there or not there, was more important for Steve than just pushing through and helping the muscles relax with pressure with my thumbs. In some ways, by doing so, would have only bolstered Steve's tendency to push and drive forward and connect with his feelings rather than allow them to come to the surface spontaneously.
Okay, that's very good, very, very good answer. So another question is, did your impression of Steven change through the time? maybe you already have answered that, but you may have a point that is more specific to, if you can tell us if the way you understood him at the beginning, then it changed toward the end or in the middle of the therapy.
My basic sense of his ability to, be a confident salesman didn't change. But what I discovered along with him was how much more there was to him. So my view changed as he revealed himself in the breadth and depth of his emotional life. He revealed, like I said, some of his dependent qualities rather than take charge, I'm telling you what to do quality. And, but my initial impression of his ability to do this kind of work and to do it so well that he could make such progress, that didn't change. And that's what has always impressed me about him. It's a pleasure to work with him and see his ability to overcome some of the obstacles that have been laid out throughout his life. And actually, one thing that's worth noting is, when his therapy started, I was pointing out, your jaw is tense. Let some sound out as you breathe. You look so confident. Do you feel that confident? There's no other feelings there. He's developed his ability to sense that in himself. He's developed an ability to say, I need to have a good cry. I'm not spending enough time with my wife to just slow down and see what's there emotionally. I'm forgetting to ask myself, how am I feeling? It's already started to shift where instead of the doctor being the one to prescribe interventions, he's able to do that a little bit more for himself. And that's been a wonderful thing to see.
That's very good. I think it's very exciting for me to hear about this patient, because I really can see how the difference or in the approach that we use as medical organ therapists can lead to results that probably are unexpected by other form of therapy or just by medications. Now, there is also another question. There is a listener who wonders if you also came up with an assessment of the general physical structure of the patient and of his armor. Did you notice any other characteristics of his armor in the other segments of his body?
So that's a good question. His chest could be very held high, and, kind of going along with his confidence, he could, puff his chest out, and that held his breathing and inspiration. And often he didn't need anything to be done except for me to encourage him to take some deep breaths, and that could relax. So as much as it could be puffed out and confident, it was still flexible. But there was a few times where just pushing down on his chest as he exhaled allowed it to increase the flexibility and increase the ability to inhale and exhale more fully. But that's the extent of it.
Okay. So before we end, is there any other things you would like to add? Or anything you want to leave the audience with?
Well, just about Steve's story, I find it very moving, and I've been very impressed with what he's been capable of doing. I would say another nice aspect to hear about was Steve became much more open emotionally with his wife and his family, but even his friends who are also often, confident, cocky salesmen or businessmen, he opened up with them about having panic attacks and about the other feelings that came up. And he almost became a leader of his friend group with their emotional lives, just breaking the seal that we can also talk about our feelings in addition to, how the Eagles are doing or how the Phillies are. We can talk about this aspect of ourselves. It's such a nice chain reaction to hear about how one person's individual therapy can have an effect then on their social circle. And Steve did that. And again, he's an executive in a company, but he has a leader quality to him. And he demonstrated some of that by leading by example with his emotional life.
Okay, we can stop here, I think. Thank you, Dr. Burritt.
Dr. Iacobello, before we stop, one other thing I just wanted to say. We mentioned the way we look at anxiety, panic and anxiety. It's very important how we look at anxiety, and that's what allows us to do this work. Anxiety is the feeling we have when we don't have a satisfying outlet for an impulse, in this case, emotional impulses. And so that's what allowed me to help Steve so much and allowed Steve to see the effects of crying and getting relief from his anxiety. It wasn't that he had anxiety that needed to be disconnected from. He needed to find out what was the impulse that was breaking through and how could he find a satisfying outlet for it. And I think that affects all of us. Steve is this moving story about overcoming panic attacks, but we can all get stuck and not have satisfying outlets for our impulses and feelings. And so that's worth underscoring, this unique way of looking at anxiety.
Thank you, Dr. Burritt.
Thank you, Dr. Iacobello. It's been wonderful.
And a special thank you to the donors of the ACO who make our work possible. I hope you check out the Journal of Orgonomy on Substack and our podcast, the Different Kind of Psychiatry podcast, until our next webinar, which is Saturday, November 16, 2024 at 11 a.m., featuring emotionally connecting with your amazing baby during pregnancy and birth with Dr. Theodota Sapi and Dr. Susan Marcel. Please note that Dr. Sapi will be speaking to us from Greece, so the webinar is scheduled at an earlier time. Details regarding this webinar will be posted on our website shortly. Thank you and see you next time.